of December 2024. I am Councillor Charlotte Golsley and I will be chairing this meeting. Before we move on to the next agenda item, please note that this meeting will be recorded. Please can you ensure that all your phones are switched to silent for the duration of the meeting. Members and officers who are present in the chamber, please use their microphones when speaking. When asked to raise your hand, members who are virtually viewing this meeting, raise your electronic hand, and members who are in the chamber, please use your physical hand. For those members virtually viewing this meeting, please can you keep the chat function for urgent IT issues and not for questions or comments, unless, obviously, in briefing this week, we did discuss, obviously, if there were questions that need to come in from certain councillors, then obviously happy to take them in the chat box. I wish to remind members signing in remotely of their legal obligation to have their cameras switched on at the meeting at all times in order to be seen and heard while participating in council business. Now I will move on to agenda item 2, declarations of interest. I have none. If any members have declarations of interest, please make an indication now.
Can't see any declarations of interest, Chair.
Agenda item 3, you will see the minutes attached at pages 5 to 20 of your agenda pack. If you feel these minutes are an accurate record of the meetings, I will propose. Can I have a seconder, please?
Second, Chair.
Thank you. Members do not indicate to the contrary, then I will take it that these minutes are approved.
Chair can confirm those minutes are approved.
As our director's got other meetings to go to, we will be considering agenda item 6C first, and I will just go straight into agenda item 6C to the director.
Thank you very much, Chair. Good afternoon, members, and thank you very much for putting me top of the list for presentations. Chair, I do appreciate it. I do have to go somewhere, so I'm not going to be able to stay for the rest of the meeting. But I did want to introduce this item, which is on performance monitoring, and in particular, I want to take you through some of the performance lines that you see in the report before you today. So I'm just going to try and share my screen, and then I'll talk you through what we need to do today. So I just need somebody to confirm that you can see that and that that's full screen.
Yeah, we can see the screen, Andrew.
Excellent. Okay, so this should be, I can't see anyone's hands up as I go along now, so I'm just going to go through this and then I will come back.
Sorry to interrupt, Andrew. Can you make it slightly bigger? I think for members,
How's that?
members at home will be able to see it, but those in the chamber is quite small unless they're on a device.
Okay, I might need people to go onto a device then in that case. Not sure my IT skills can make this any
That's
any
all right,
bigger at
because
this stage.
members got their, most of them are on nothing, so they got mod gov anyway.
Okay, that's good.
And I
Okay,
got a
so-
copy.
So we've talked a lot, haven't we, over the last year or so about the sort of performance information that Scrutiny would want to see. And it is very important that you do see the right performance information that reassures you that the Social Services, Housing, Community Safety Directorate are heading in the right direction, are taking care of business and doing the things that you as Scrutiny would expect us to do. So as you can see from this list, we've got over 100 performance indicators that we use as officers at the various levels within the organisation to manage our business. Now, as we share some of these with you, I just want you to bear in mind that the performance management reports that we've got are just figures. I know they represent activity, but they are just figures on a piece of paper. They're not going to tell you the whole story, and it's really important that we hold on to that going forward. So just looking at the figures on these pages are not going to tell you the whole story about how the service is operating. In order on any particular one of these to better understand what's going on, you would need, Scrutiny members, to look at the quality of the work that sits behind the figures, but also the feedback from service users and from staff around the service delivery. So just to reiterate, these performance measures don't give you a full story about anything. What they do, of course, is they do indicate where we might be having difficulties or where we might be doing particularly well. By looking at trends, they help us to understand where differences are occurring. And then what we need to do is to delve into that deeper to understand a bit more about why those changes are happening. So they are good indicators. And of course, the most important thing with performance information like this is that it is both accurate and timely. So on each of these, we've worked really hard to make sure that the information is accurate. Not that you're going to see today the all of the information and the accuracy, because you won't have time to look at it today. But we've made sure that the performance information that we do collate is absolutely accurate. And as far as timely is concerned, well, we can make these reports be published for whatever timeframes we like. So right up until the end of last month, we can go from there all the way back to whenever you want to go back to. So you can actually name the timeframes that you want to as we go through this. As I say, what I intend to do today is just show you some of the reports very briefly, with the aim of familiarizing you with what we can and can't collate. But more importantly, then trying to get some input from yourselves about what are the performance indicators that you want to have a look at on a more regular basis. So if we chose 10, 11, 12, whatever you want for us to concentrate on over the next year, and then we would bring those back to you at each performance indicator session, and we would talk to you through where we're at, what the differences are, and what our understanding is of those figures. You may also, as we go through, decide that there are particular performance indicators where you want to do a particularly deep dive as a scrutiny committee. You may want to have a task and finish group to work, a few of you with officers, to reassure yourselves that the information that you're seeing on the face of it and the background to all of that information is properly understood by you as a scrutiny committee, and again, that you are satisfied that we're doing the things that we need to do. So on that basis, I'll just take you through what sits behind some of these indicators, and I'm not going to go through them all. And if there are ones which you've spotted in particular, you want me to actually highlight, and I don't highlight them, we can always go back and do that. Again, today is not for you to start to scrutinize the figures. It's for us to get to a set of figures and set of indicators that you want to take forward at the next occasion. So if I take you through the first bit in the first instance, so well, let's start. This is children and young people services. So I'll start off with the number of contacts. So we can measure from whatever timescales you like the number of contacts we receive into the children's services single point of contact, and we can map those out as far as contacts received on new cases, on closed cases, contact received on open cases, and the total contacts, which is that line that you see at the top. And you see that generally the trend is going up. That aligns with what we've been telling you about increased demand in children's services. So that's one of the indicators that we look at, and obviously it's really important for us to understand what's coming in our front door. We then look at our response times, and you'll see underneath that's CYP SO2. So this is the percentage of contacts where the decision was made within 1 day. So that's about whether we are dealing with the contacts that come into children's services in a timely way. So obviously, if we were taking longer than a day, then that means that we are not assessing on that day, and we're leaving unallocated work until further days. You'll see, and hopefully you'll be reassured that actually that isn't happening. If that was to change, I'm sure that you would want to understand that in more detail. So go back to this list again, I'll choose some other ones. So if we looked at the number of children on the child protection register, and if I take you to that, so this is a trend line. So again, we can put things into trend lines, or we can put things into pie charts or bar charts. This is a trend line, so it's got the timeline underneath. So this particular one is from August 24 all the way through to November 24, but it can go back however many years you want it to go back. If you want to see whether we are having more children on the child protection register or less, we can map that out for you, and you can see that. Again,
And
just
can I
look.
just come in a minute?
Yes, of course.
Question on that one now. So obviously these are all the charts and everything else, and then it's the staff that actually write the reports that obviously go with that, yeah?
Yeah.
So again, or do you have something that's obviously there, like say for instance on that one now from September, it was 80, but then now it's down to 69.
Yep.
Obviously, is there a chart or is there something on that system that actually gives a bit of a report why that's happened, or does that come in if we ask for them figures? Because obviously
No.
these charts are fantastic to highlight straight away if there's problems in that, as in data. Yeah. But again, it's as you say, it's the background story. So
Yeah.
I'm
So
just in my head, I'm just trying to calculate obviously the extra work then that's needed to be done with just having the stats, and then obviously the background work then that needs to the report to go with that particular request that we give.
Yeah, absolutely. So it's not going to be extra work for the staff because the management analyze what this means on a regular basis. So they will be asking exactly the sort of questions that Scrutiny will be asking, which is, why is this number gone up? Why has it gone down? They break it down into categories. That's another one of the performance indicators that we've got. So if you as Scrutiny want to look at this in more detail, you could easily call this in and you could say, actually, we want to know. So for instance, I know if we looked at this chart for the last 10 years, probably we started off with 260 children on the child protection register. It's now down to 70. So Scrutiny might absolutely want to ask, well, how has that reduced? So officers and the managers, myself included, we've all asked those questions. So we will be able to talk you through and show you what we've done in order to reduce the number of children on the child protection register and how we are assured that we have that those children who are at risk are on the child protection register. So those children who need a protection plan are on the child protection register. So we can talk you through all of that. And we can either do that by you calling in a separate report chair, or you could say, actually, we want some further reassurance to look at the detail. So you could start a task and finish group, ask for a number of volunteers from the Scrutiny Committee to work with officers to fully understand and go into real detail about this particular measure, or it might be a different measure. So we can do any of those things, Chair, without it taking a lot of work for us. And I would encourage members of Scrutiny to take those steps, because from our point of view as officers, we want you to understand this as well as we do, because then you'll be able to ask the questions that you need to ask to scrutinize us, not just as far as the performance is concerned, but also the practice. Is that okay, Chair?
Yeah, that's great. Yeah.
Okay, so I'll just take you through. So that's the number of children on child protection register. If I just go back and, because I know this has been asked before, so there are, is that one there? Percentage of re-registrations of children on child protection register. I know the Councillor Freegard particularly has been interested in this. I think it's a really interesting figure for Scrutiny to be interested in, because this is an indication of how effective we are at de-escalating risk for children. And where we see children coming back onto the child protection register within 12 months of being taken off that register in the first place, then we start to worry that actually we're removing children from the register too quickly. So this, again, these are figures which we've got from whichever years you want to decide you want to look at. But if you looked at 22, 23 there on the left of that table, you'll be able to see that. And this is a cumulative. So from April to June, April to September, April to December, and April to March is the full year effect. And you'll see that that in 22, 23, it was 14.7%. And that equated to 11 children being re-registered within 12 months of being taken off the register in the first place. So again, you might want to look at that in a lot of detail, because on the face of that, Might seem a lot to you, it might seem not very lot to you, but I don't know whether you'd be able to tell just by looking at that whether that's a good thing or a bad thing. You'd need to understand that in a lot more of the detail. And again, the officers in Children's Services will be able to take you through that, either in a report to Scrutiny, if you are able to tell us exactly what it is you want, or we could do that as a part of a deep dive. So just move off from there then. So as you see, there's lots of others. So that's the child protection, some of the child protection ones. You'll see others there, which are important. You will see looked after children. If I just pick one of these, number of looked after children, so this is admissions and discharges. So just before that, if I show you that this is a number of looked after children on this trend line. So that's from June 21 to April 24. So the last 2.5, 3 years, you'll see that we've had a reduction from 286 to 230. So you might think that's quite a gentle decrease. You might think that's quite a significant decrease. What you may or may not know is that that is probably against the trend of increases across the rest of Wales for most local authorities. So while we're coming down as far as the number of looked after children that we have, most other local authorities will be going upwards and going upwards significantly. And again, we can show you this information in lots of different ways. We could show you how many children per 10,000 we have in care in Neath, Talbot, and we could anonymize data from other local authorities to show you what their number per 10,000 was, because that might give you some idea about where in Wales we're standing at the moment. And I would say we are probably now, whereas before in 2012 we were probably the highest in Wales, probably the highest in UK actually, of the number of children per 10,000 in care. We're probably now in Wales one of the lower, at the lower end of the number of children that we have in care per 10,000 children of the population. So again, you might want to have a look at that. You know, that might be one that you want to keep an eye on and ask some further questions on at some later stage. So I'll move on from Children's Services. So then from there, you've got further information about looked after children. You have information about care leavers, so those children who move from being looked after to the next stage, which is leaving care and how we support them, etc., around providing them with accommodation. You'll see something at CYPS 18 about unallocated cases. Again, that might be an issue that you want to have a look at in more detail, or you want to keep an eye on. So that might be one that you want to look at. And then we start to move into the experience of our staff. And this is really important. So experience of our staff. So it's really important. We know that staff who are going to be retained, who come to Neath Talbot and stay in Neath Talbot, need to feel supported in the decisions that they're making, and not to have too many cases. So the support that we give them is the supervision and the management oversight, and you will see that on there. I'll show you that in a second. But the workload is about the average number of cases that they hold, and I'll just show you that. So you will see here from January 21, the average caseloads per qualified worker across Children's Services moves up and down between 10 cases and 12 cases as you go forward. And again, I think I can see in November 22, that went up to, looks like 14 cases. So it increased on average. I think that's, you know, a significant increase. And if that was happening now, you might want to ask what that means. When I started in Children's Services, the average caseload was over 30. So it's come down significantly over the years. And I think where we are at the moment, probably between 10 and 12 is probably where we want them to be, because we know that social workers are holding complex cases where they have to do complex assessments. Then if I take you down to the other part of the support for workers, which is the amount of supervision they get, which is the time that they spend on their own, sitting with a manager, talking about the cases that they are trying to manage, getting advice and assistance. is, that's an important way of supporting social workers. For those of you who've been on committee for a while, you'll know that I think this is really important. And I've always said, if it drops below 90%, so that's 90% of people, of social workers receiving supervision within 28 working days. So on a cycle of 28 working days, if that falls below 90%, I start to get worried because that means they're not getting supervised often enough on the cases that they need to be supervised on. So again, when we're talking about staff welfare, retaining staff, that's one that you might want to have a look at. I'll go back up, then I'm going to move on to just quickly onto, so just before I move off children's services, we also then have a breakdown of safeguarding issues, child protection issues. So we've got a number of children on the child protection register by category. Extra familiar harm, so we've got graphs around that. The number of unexpected deaths we have as far as children is concerned, that's called PRUDIC, procedural response to unexpected deaths in children. So we've got graphs on that, and child practice reviews. So we do child practice reviews when a child suffers significant abuse and there are lessons to be learned. We do a child practice review. Again, might be interesting for you to know how many of those we do and what sort of lessons we learn from those child practice reviews. If I move to adult services, I won't go over this in that much detail because it's much the same, but you'll see there we have a number of contacts received. So again, this is a replica of what we did in children's services. So this is the number of new inquiries we get into adult services on a monthly basis. A number of new contacts that we get, as you see, generally the line is going up, not steeply, but it's going up over the years. And that means additional work for the front door and obviously leads into additional cases being open. So there's a number of reports that we've got around the pressures at the front door for adult services. If I go back up, I'll just talk you through some other things. So you've also got then the social work caseloads by team. Again, that is a replica of the children's services. So you will see how many, so you'll see the teams here broken down. So we've got the Avon network, Neath network, the hospital team, the Upper Valleys team, the community mental health teams. You'll have a look along that table and you can see the average caseload per worker. Okay, so that's, if you compare those to children's, generally in line with what we're asking the children's social workers to do. But there are a couple of outliers there. And again, you might want to ask them questions about, well, why would that be? Why would there be more cases on the adult side for social workers to deal with? There are good answers to some of that, but you'll see some of the average caseloads in the Avon network are 22 or over, and in the Upper Valleys, 18. So that, as I say, that's significantly more than the 10 to 12 that they hold in children's services. You might want to understand a bit more about that. Go back and just finish this off for adult services, and then we can get into some sort of discussion. If there's anything that you want me to go over in particular that you've seen that's caught your eye, you want me to go back to, I'm happy to open up anything else. We then talk about direct services in adult services. There's one about the number of hours of external domiciliary care that we commission. So that's about the commissioning. So you've got a graph which shows you internal. I'll show you that one. That's internal. So that's how many hours for the timescale that you've got there. So the quarters. How many hours we're commissioning of internal domiciliary care, and then just below that is a bar chart on the external commissioning of domiciliary care. And that's important for you to understand because you want to know as scrutiny members, well, actually, do we commission more external domiciliary care than we do internal domiciliary care? Is that gap getting bigger, smaller? What does that look like? And I can tell you that, in fact, we do commission a lot more external domiciliary care than internal because we don't have the staff internally, because at some stage we decided that a number of years ago decided to externalize a lot of our services, including domiciliary care. So I think when Angela, the head of service at the moment, came in, the breakdown was probably we were 10%. We were able to do 10% of calls internally. The 10% of the market was our internal services, and 90% was externally commissioned. And obviously, what that means is that we very much are at the behest of the market and those private domiciliary care providers. And I know that Angela's strategy has been to build our internal provision up. And again, you might want to understand that in a bit more detail at some stage. So then we move on, and in adult services, you can look at how many people are waiting for domiciliary care. So that's an important one when you look at, how many people in the community are waiting for domiciliary care. So they've had an assessment, but they're waiting for their package of care. And also how many people who are in hospital and will be awaiting a package of care. Go through some of this. So the number of deprivation of liberty referrals that we have each month, you'll see at AD 26, and more information around other DOLs, as we call them, applications, some of the breaches that we have. So that might be something which at some point over the coming years you want to look at. Probably quite a complex area of work. So, if you're going to look at that scrutiny, then you would want to have a task and finish group to properly understand that, because there's lots of legislation around that. And then in adult services, it goes on to responses to suspected suicide and near misses. And then again, you look at the percentage of workers, both qualified and unqualified, who've had supervisions. So again, replicating what we measure in children's services. Then you've got the early intervention prevention sort of work that we've got, which is, how many people we're supporting around early intervention prevention. So not actually up to that statutory service, but actually preventing people coming into our statutory services. Number of people responding to by our mobile response work that we do. And that brings the adult services section to a close. But again, I can open up any of those that you want to if you're particularly interested. Then you go into housing community safety. So you've got the whole of the disabled facilities grants analysis there on the first 1, 2, 3, 4 performance indicators. And then you've got the information about the empty homes grant. You will have the number of, I'll show you this one, housing options, so number of presentations to housing options. So how many people are coming and saying that they're homeless? Well, that will be a graph that looks like that from October 22 to September 24. So interestingly, pretty steady. So number of presentations are looking as though they are staying about the same, maybe going up slightly. But what you wouldn't know by looking at that is the difficulties we've got in temporary accommodation are because we can't get people out of temporary accommodation. So we've still got people who are presenting and having to be assessed as homeless and being placed in temporary accommodation, but we can't get those people who are in temporary accommodation into longer term accommodation. So that's something which is, should be interesting to you as scrutiny, because that costs us a lot of money. And it's not good for those people who are stuck in temporary accommodation for a long period of time. And as you can see there, that next table shows you, graph shows you that from October 22, where we had 191, we've now got 229 people in temporary accommodation at any particular point. Okay, so that's housing. Let me just have a look, and then we can show you the number of children in temporary accommodation, because it's never good to have children in temporary accommodation. Number of families in bed and breakfasts. Again, we've worked really hard to try and minimize the number of families we have in such unsuitable accommodation. From HCS 16, you then talk about the the drug use area planning board work that we do. We do this as a region, but we collect information about Neath, Talbot against Swansea as well. And you'll see a number of suspected drug-related deaths, non-fatal overdoses. So we've got a whole suite of information there if you were interested in that side of things that we could talk you through. And then it goes on to the community safety, which is, starts off around domestic abuse, goes into antisocial behavior, risky people in the community, then moves on to we collate information about in this situation number of Ukrainians that we have in hotels across Neath Talbot, and a number of indicators around resettlement. So, Chair, I think that's as far as I want to go as far as talking through this. I hope that members have found that useful and given you some idea about the huge scale of the collection of data that we do across the directorate. And I think what's left now is if there's any that you particularly want me to show, then I'm happy to do that. If there's any we need to discuss, I know that the heads of service can give you advice about a number of the indicators that they think would be a good idea for you to have a look at over the next year or so. I think if we chose probably 10 to 12 indicators, Chair, I think that would be good to be getting on with, albeit that we might group some of them so we could do more. But really ones where you want to have a bit more of a deep dive. So if you've got suggestions as a scrutiny committee, we're happy to take those on board. If you want the heads of service to come up with some suggestions from that list that I've gone through and that you've got in front of you, I'm happy to ask them to verbalize that on your behalf if it helps. So, Chair, I'm going to stop sharing my screen now and I will come back to you.
Thanks, Andrew. I think there's a lot of things to actually think about on these, because there is a lot of data and opportunities to actually look further into. I think as well it's about us getting the balance right as well, rather than having loads constantly. It's main ones. I think ward councillors are always very interested in, sometimes, say for instance housing, how many people are actually on the register waiting for housing. Does the actual data that we have separate into ward areas? I know obviously we've got different teams like Avon team and Neath team and that, and again how many are waiting for or looking at being potentially homeless in certain wards. Do we have a breakdown of ward areas? I know all councillors would obviously be interested in that, but
sorry, Chair, I because I'm not in the room, I can't see, but there are officers who have the expertise to answer those. Yeah, okay.
For the homelessness, no, we don't have it by ward. Unfortunately, we don't have that broken down by ward.
Okay. Yeah, so going forward then back to the actual data figures, I think if we can actually look at Ian Finney-Moore wants to come in.
Yeah, sorry, Chair. For most of the children's and adults performance data, we can produce it by ward if required or where it's appropriate.
Okay, great. Thank you, Ian. And I think having the information, whether or not it's ward on different, what we can do and what we can't do, I think that would, because obviously on casework that we deal with every day, it'd be nice to have a sort of a summary of how our own wards are doing as well. But obviously going back to this now, I think that there's certain codes that we would look on quite regular and sort of get into a routine of seeing them, especially around the single point of contact, the figures that are coming in through the doors there, domiciliary care. I think it's them issues, the child protection, the safeguarding issues. And then if we actually look at the forward work programme and see what reports are coming, and then look at some of the data that may not necessarily be on them particular papers, then maybe we can request that they fall into line with that actual document coming in. I think that would be much easier for us and yourselves as well preparing. So I don't know what you think on that, Andrew.
No, that's fine. I think so you've given us some indication about the sort of things you want to look at. Do you want us to go away and then pull together a list, Chair, for yourself? I don't know whether any of the
Yeah, that
members
would
have
be
got
really
views
helpful
on
if you
that.
can.
But actually take your point on where we're bringing reports in. If we've got performance information that relates to those reports, that we should put those in to help scrutiny and better understand. Absolutely,
Yeah.
we can do that.
And I think as well, you also do know that we like to know the full truth and nothing but the truth, the ugly figures and the facts. So again, focus more on the priority areas of where we have the issues, mainly in the hardships. So again, we can look at that. And then obviously the softer sort of, where we are really excelling, obviously, we look for the scrutinising where the problems are, I suppose, to look for solutions as well and to support you. So yeah, I would be more than happy if you and the staff could do that.
And would between 10 and 12 indicators be about the right number?
Yeah, go for 11 then, and.
Okay. Yeah, fine.
Yeah, that's fine. Right then, if we, the recommendations, the member review the full list. Obviously, we've just discussed that with the director, what's going forward. There, yeah. So do members have any questions now to the officers on what we've just discussed? No, I don't see any. The recommendation is listed on page 227 of the Cabinet Agenda Pack. I will propose. Can I have a seconder, please? Seconder. Alan Lockyer. Members, please indicate if they wish to abstain.
I can see no abstentions, Chair.
If you do not indicate to the contrary, then I will take it that this decision is supported to Cabinet. Yep. Right, Andrew, I take it now you're leaving.
Yes, thank you very much, Chair, and thank you, members,
nice
for your patience
afternoon.
today. Thank you.
Thank you. Right, straight into agenda item 4. No. Right, okay, this, yeah. That's what throws me every time. Right? As I was telling you earlier. I was like, where is it? Right, so straight into 4A, which is the Care Inspectorate Wales, Foster Wales, Neath Talbot inspection report. Bear with me, and I assuming, and who's giving a brief on this?
Good afternoon.
Kerry or Victoria?
Good afternoon, Chair. Just to introduce Vic Smith as the lead on Looked After Children, who led on the work in preparation for the inspection. And as with everything, there's always a team around me and a team around Vic with regards to this piece of work. It is a very pleasing report. I appreciate what the Chair has said in relation to bringing everything to your attention. And I think that's what we always try and do in terms of being transparent. But I must say to you that when we met with the inspector, and obviously not all of this is included in the report, but he did describe Looked After Children in Neath Talbot, led by Vic, as sector leading. So that was a very heartening thing to hear from inspectors who are not always very complimentary, in relation to perhaps social services. So without further ado, I'll bring in Vic to give a summary.
Lovely, thank you, Kerry. And thank you for that lovely introduction. It was an inspection that we hadn't had for a very long time. So it was a positive exercise for us really to come up with kind of a baseline to make sure that we had everything in place. Sorry, we're all very ill in my house, and I have an ill child, and I'm not very well either. So excuse the voice. We pulled everybody together, and it gave us a real good opportunity of a real good health check of the service. And I'm really pleased. We had some lovely comments back that we are meeting the needs well of all of our children that we look after by our fostering service. Pleasingly, we had no action points, no non-compliance points, which I was extremely proud of. And I think what came across was the strength in the support that we give our carers. We've obviously been through very difficult times, haven't we, from COVID, and how we needed to support through those times. We've also got additional pressures with placements, and obviously the pressure that comes with that, with what's going on with the eliminating profit. So I think in Neath Talbot, we look after our carers, and we had a very lovely event 2 weeks ago where we celebrated the success of our carers and an award ceremony and appreciation event, which is great. So I guess the only points for me to pick up on were, and as I said yesterday in Cabinet, was that we speak to children and young people all of the time. And I think I need to get tighter as the responsible individual. I write the quality of care report every 6 months, which analyses the service. And what I will do going forward is make sure that instead of having separate reports, because we hear of our participation and engagement officer all of the time, I need to get a little bit tighter at pulling that together in my annual report. Because as you know from Kerry, through it runs through the veins of children's services, speaking to children and young people, and how that informs practice going forward. So on the whole, extremely proud of the team. I'm extremely proud of our unsung heroes, which are our foster carers, and the work that they do for our wider community. And hopefully this will, a good inspection, we've got a media campaign looking for more foster carers, and it will just add positively into that. So thank you.
Lovely, thank you. And some of us sit and on obviously corporate parenting and see the fantastic work and have a lot of feedback from the children themselves and different groups and projects. So that's really good. So is there any questions from any members? There wasn't obviously in briefing on this one. And I can't see any now. So you let off the hook now, Victoria, look. So especially because you're not feeling well either, look.
Thank you.
Right, thank you for that. So we're going to go straight on to agenda item 4B, which is the corporate plan annual report. And this now is Victoria. Louise, you're sitting very, very patiently in the chamber here. Yeah, so do you want to give a little bit of a briefing on this, please?
Of course, thank you, Chair. So the corporate plan and report is the reflective document for 23-24. The report presented is a summary of progress made on the delivery of the Council's 4 wellbeing objectives, which were approved by Council in March 2022 as part of the corporate plan for the 2022-2027 period. A full breakdown of progress against our aims and measures can be found throughout the report. The 2 pages included on the covering report, which were raised at pre-briefing, page 46 and 48 of your pack, were intended as a brief overview. So it just states there's 2 tables with the numbers of aims and performance measures, so they are further detailed in the annual report. Heads of service will be able to answer any questions you have on their service areas, and I can take any general questions on the corporate plan or the formatting of the report. Thank you, Chair.
All right, okay. We did have some questions on this from councillors that are not here today because they're sick. However, any other members got questions on this? No, because obviously the one that was asked, I picked up on, which is, you've just answered that as well, which obviously the measurements later on in there. The one thing that I actually picked up on myself is a lot of the ambers and the greens are a lot of paperwork, exercise, things that we've done well on, which I would expect as a council, because that's obviously officers' jobs. What we're not delivering on is actual delivery itself. So say, for instance, there was one which is about the Welsh language, which is a green. Then school expulsions, and I know that's not in social services at the moment, because obviously, but that's just an example for you. But then expulsions or things like that are like ambers. So to me, I think there's, with the measures, there's 2 different things here. There's the paperwork exercise that seems all green, and that's through all the directorates. But then the actual delivery itself, and that's one thing that I've had issues with the regional partnership, and that is about the delivery to the ground. We're not seeing it. It seems as if we've got a lot of support services as well going to sort of like cotton wool linen, people and families a lot of, and then we're not having frontline services investment more because we've got all these different services. And then it seems as if there's a lot of grants going out to organisations constantly, but then what are we doing to actually scrutinise them more? Because it seems as if, well, if they do well, they won't get more money. So it's sort of like, it's a catch-22, I suppose, because everyone wants to put on the full bad story, whereas the figures aren't really showing that they're bad, but they're coming in for more money. So again, I think as overall, I think there's a lot of issues, and it's been a really good document for me, because we obviously, my main committee is this, then to actually for other councillors and members to see across the directors that we don't sit on, I think it's been quite an eye-opener. So I think that's really good. And I know one of the questions also I had is who chooses the measures in the paper?
So I'll just come back in on your first point first, Chair. So the corporate plan is obviously, well, it was the 5-year period. So a lot of the ambers that you were talking about is that they're on track to be sort of achieved by 2027. So as you say, it is a slow process for some of the activities that have been delivered in the communities, and also some of the capital works as well. So they will obviously take the time to be showing on track. In terms of who chooses the measures, obviously going forward within the 24-27 corporate plan, a number of those are around our transformation projects and invest to save. I think it's probably noted in some of the measures that Andrew went through that there is a piece of work to do around more involvement, and I think it comes back to where we need to be directing our services due to budget priorities, and we recognise there is a huge piece of work that we need to do in the monitoring and performance. This has been the 4th scrutiny we've brought this report to now, and I think the sort of general feedback is we need to be stronger on our monitoring, and whilst we can't tell you everything in one report because it'll be a huge document, there is, you need to have more of the key points rather than just sort of, paragraphs upon paragraphs. We need to be more concise. So definitely take on board your comments, Chair, and it will be fed back into a sort of next quarterly performance monitoring, which will be in the new year then. But as I said, there is more work to do on involvement as a whole, so involvement of officers, involvement of members, to make sure that we are putting the right performance measures in our corporate plan. I think the other thing to mention, and again it comes back to some of the work that Andrew was talking about, the corporate plan is underpinned by service delivery plans as well. So whilst you might not see all the information in the corporate plan or the annual report, a lot of that information may sit underneath, and that would be something that perhaps can be brought to scrutiny, is around their delivery plans as well, so you get some more of the operational detail. So I hope that sort of answers your question.
And more outcomes actually of the data figures, I think, is going to be key going forward as well, and seeing it, because obviously there's some which is like new coming on, especially like with the wellbeing team and that. But yeah, it has been a bit of an eye opener to me, to be honest, looking at it. So thanks for that. Yeah, Alan.
Sorry, perhaps if I could just add to that, because I think it's important discussion, isn't it? And obviously, while the annual report is retrospective, it is looking back at the period. I know we've got an item coming up as well on the monitoring of the current plan, and I think that there has been a bit of a difference in the way that the new plan has been formulated, because of the amount of contact between the strategy team and the different departments and the heads of services in terms of forming what goes into the plan, and obviously before it came to us as members for adoption back in the summer for full council. So hopefully you know, there'll be a relevance there in terms of monitoring it because of the input that all the departments have put in to forming the plan before it went out for publication.
Yeah, and I totally take on that on board. But what I'm actually seeing was that the measures are based around not what the people and the public want to know about. It's like certain things in there are paper exercises that mean absolutely nothing. And it's like they want to know, well, what about, about their bins and the drainage and the provisions of parks? And, I seen one thing in there about the youth service and the youth provision in Bryn, but it's not saying that we got no staff to actually staff the Bryn. So when the children go to the youth club, there's no staff there to let them in and have a good night. So again, it's a document. I'm not a favour of the document anyway, and everyone knows that. I like to see delivery out in the communities and it being done. This is just pretty documentation for me. And it's no offence to you, Louise, because I know you put a lot of work into that, right? And it is lovely colours, right? Everything. But I think going forward, we're going into tougher times. We need more results. We need more results on the ground going forward. And no matter who's responsible for that, it's about a team effort of all of us taking it forward and challenging when their challenges need to be done. But as I say again, that has been an eye-opener for me.
Yeah, no, thanks, Chair. I think it's a very relevant point, and I'm sure it's going to be sort of taken back as part of this process, particularly as we're still in quite the early period of the new plan. And strange enough, exactly I know it doesn't come under the remit of this committee as such, but exactly what you talked about just now in terms of youth provision staffing was a discussion I was having this morning as well.
But there's also a lot of things on education that should be working more closely, I think, with social services as well in there, because there's some things on theirs which I think it crosses over with some of our things, mainly obviously in children's services and that, and like around the family and things like that. So again, it's just observations that going forward, and as we are here to scrutinise. So yeah, marvellous. Any other councillors have any questions? I can't see any. No, so I'm going to move straight on again. Done that one. So we're going on to agenda item 5. To consider items from the Scrutiny Forward Work Programme. 5A, Adult Service Prevention, Early Intervention and Community Services Progress Update Report, please.
Thank you, Chair. It's this the first time we brought this report here. It provides a summary of the service activity in year 23-24 and 6-month update for 24-25. Principal Officer Sarah Waite is here leading this team and available to take any questions as they arise. Thank you.
To be honest with you, I think this is a very straightforward, good report, especially when it's been the first one as well. The one question that we had on this was due to the digital thing. We've obviously put in so that members to have a visit up to Tonna. Tonna it is, isn't it? No? Kimla. I had Kimla in my head, but I said Tonna. To have a look at that, because I think it's really important for members to see what is available in that, because it's fantastic equipment. Also now you've gone over from, was it analog to dialogue, is it? Oh. Digital. I still not grasping that one, but it's over to digital. So obviously there was one point that was picked up that it wasn't working in some areas. And can you just give us a bit of an update on that, please?
Noted. We've taken that information back to Mike Morris in our digital infrastructure, who's looking at black spots, if you like, across the county. And actually one of the areas identified was underneath the M4. The M4 is Wi-Fi strong, and they had thought that it had gone underneath. So with the information we're gathering from black spots, we are sharing that with infrastructure to make sure that they can look at strengthening those in those areas. And we are also working with our with the providers, so the telephone providers, to identify areas where it's not possible to turn over to digital, and looking at doing some prioritization of keeping them at analog until the infrastructure is of sound quality, really.
Also, any other questions by any other members? No. So it's another one from me then. So, well, it's not so much a question, but the I find now, because obviously the local area coordinators, we've had a bit of a bumpy ride on that, but it seems now as if we're really getting that right, and the team, I think, are really phenomenal out there, and the work they are starting to do and the things that have been identified, because I just want to obviously thank my own one, Jenna. Obviously, you know, we actually found a gentleman that obviously had been lying on the floor for 2 days, and if she hadn't gone back and gone back and gone back, then he could still be lying there. So again, I think these are priceless roles, and it's really well done to you and the team for obviously now, you know, getting it right as well. And obviously there's room for improvement going forward, we know that, but that's in plan. So again, big thank you for that. But where there was no other questions on it, it was a really welcomed report actually. So that one. So going on to agenda item 6, performance monitoring. Going straight on now to item 6A, which is the Care Inspectorate Wales Assurance Check of Neath Talbot Council Adult Services.
Thank you, Chair. So Care Inspectorate Wales meet with adult services biannually. So we get 2 meetings a year, another meeting with all heads of service and the director once a year. And then periodically they'll come in and choose a council for an inspection. This will be the first time that we've been inspected since 2017, so that speaks volumes about how they consider we're working in adult services, but they have to do some form of check, so they consider this to be a light touch assurance check. That said, any inspection, however light touch, is particularly onerous, so it did consume most of August and September to get us where we were. I'm happy to take questions. If I could just say, it's a something and a nothing. So they inspect us under the 4 principles of the Social Services and Wellbeing Act: people, voice and control, prevention, wellbeing and partnerships. No discussion at all about the real things that are hitting us: budgets, hospital waiting lists, risky people and agencies walking away. So for me, when I'm having these sort of discussions, I say, what about the real world? But you can't say that when you talk to inspectors. So I'll stop there, Chair, but I'm happy to take any questions that anyone has.
Peter Richards, please.
Yeah, thank you, Chair. Welcome report, Angela. Item 2.9, carers not consistently being offered an assessment. I know this has been a challenge for many, many years, so can you just give us an update on that?
Yes, I can. And again, this is where things get a little bit misconstrued. So what we informed the inspectors is last August, and Sarah's here who leads this team, last August we took a decision to bring the carers assessments back in-house. So we took it away from CVS, NPT carers, sorry, and brought it back in-house. And we trialled it in our Neath network. And what we informed the inspection team is, if this was a success, then we'd roll it out to our other 2 networks in Avon and Upper Valleys. It was a success, it is a success, and we've now got it in all 3 areas. But the way it's reported is as inconsistent. Well, yes, it was inconsistent because we were trialling it, but that isn't how it was reflected. I didn't challenge it because if I didn't know what I was doing, then I'd have an issue. But yeah, I can reassure you now, Councillor Richards, that assessments are up there in the 90% across the three areas. So it's a marked improvement to where we were when it was outsourced.
Thank you, Chair.
Okay. That was we did have a question off Dave Whitlock as well. But Dave hasn't been able to make it today. So off the top of my head, I can't remember what it was. If you just bear with me. He's in the same area, wasn't it? Is it on this one?
Chair, it may be worth, I've asked Chris Frey-Davis to come along today because I think when we received the report, we looked at it and I know Chris and his team were saying it was contradictory, some of the things that were being said in the report and then the actions. So I don't know, Chair, if you wouldn't mind, Chris, just giving a very brief update on the safeguarding side of things. Chris?
Yeah, no, happy to come in. I think one of the questions, Chair, if I recall rightly from the email, was around kind of some of the assessments, timeliness and recordings. I know that when the team manager and the team were preparing for this, indeed before preparing for this and receiving notice that they were auditing decision making in respect of decision making and adult safeguarding. So some of the issues that the inspectorate flagged, rightly so, were already flagged by us and were being worked through by the team at the time. I think really important to bear down on, though, that the inspectorate looked at 6 cases and we looked at over 30 prior to the inspection. And whilst there were some issues around timeliness, so they have 7 days to complete their Section 126 inquiry, I think it was the quality of the work thereafter and the reasons for those inquiries going over the 7 days that were important to note as well, because some of them were the result of police investigations being dragged out and some difficulties engaging individuals who lacked capacity as well. So there was a context to some of those cases moving out to timescales, but I just wanted to offer further assurance. You'll read it when the biannual safeguarding report comes due in the new year now, but also over the course of the year, as Andrew talked about in respect of data, we'll bring back the forward work programme we have in respect of multi-agency audits, dip samples, internal learning and lots of other quality assurance work that will go on and goes on across adult services and the broader service with our partnership and with practitioners. So look forward to sharing that with you so you can see the progress against this report and indeed the progress we're making to respond to this kind of growing and ever complex world.
Yeah, great. And you have answered our questions, actually. Yeah, we did finally find them. And you obviously answered and the David Loft's concerns he raised as well, as in he just wanted to know what was an update on what was being done. So yeah, thank you both. Yeah, that's just for noting now. So we'll move straight on and we're going back to the 6B, which again is the corporate plan half-yearly update. And this is also a report for information. And officers going to give a little brief beforehand, yeah?
Thank you, Chair. So as you said, Chair, the report is a reflective document again on the work undertaken between April to September this year on our strategic priorities and performance measures as set out in the revised corporate plan for 24-27, which was adopted by full council in July. The report has been presented to Cabinet and the 3 other scrutiny committees, where members have made a number of suggestions around the performance measures, targets, and suggestions to the way we could improve the look of the report. And these have been noted by officers. We're on track to deliver the majority of strategic priorities by 2027. One of the priorities which is currently off track at the moment is the home to school transport, which is on pages 181 and 184 of your pack. This was raised in Education, Skills and Wellbeing Scrutiny Committee, and an update will be taken to that scrutiny in the new year. So I know there was some questions again in pre-brief, so hopefully that update in the new year will answer some of those questions for you. Again, happy to take any questions and heads of service can answer any questions on their service areas. Thank you.
Yes, to be honest with you, that was the only question that came up, and it is a big concern across all of it. It says off track. It actually needs to get back on track, doesn't it? Doing quite clearly. And I don't think there's any other questions, to be honest, on that. So that was quite nice and easy one for you today, really, isn't it? A lovely one. Right. So again, that's for information only. I'll go. Oh, we've done 6C. So now we're going on to agenda item 7. Selections of item for future scrutiny. So I'm going to hand over to Pam now.
Good afternoon, all. I'll just go through some of the changes to the Cabinet Forward Work Programme. There's been a few reports added to the Cabinet Forward Work Programme. One is the Supervision Policy and Guidance Report, added to Cabinet for the 5th of February. There's been no indication so far that members would like to select that for scrutiny. The next report is the permission to proceed with the remodelling of supported lodgings for young people. This has been added to the Cabinet for the 19th of March, and members have already indicated that they'd like that for scrutiny on the 13th of March. We will be adding on the Social Services Director annual report, but I'll have to liaise with Andrew Jarrett of suitable date for that. So I'm moving on to items that have moved on our Scrutiny Forward Work Programme. The permission to proceed with remodelling of care and support at Tremaglin. That has moved from today's meeting to the 23rd of January, and all these changes have been in consultation with the Chair. Commissioning intentions for a Housing First service, that will be coming to scrutiny on the 13th of March instead of January. The update report on the single point of contact service has moved from today's meeting to January. Permission to tender for emergency accommodation for women, that has moved from January meeting to March. And permission to tender accommodation models for young people has moved from January to March. And also that report title has changed, and it will now be on the Forward Work Programme as Young People Housing Support Grant Funded Services, permission to retender. The next report is permission to proceed with the remodelling, I just said that one, of supported lodgings for young people. Yeah, I've already done that one. Okay, thank you. So there's a few reports added to the Scrutiny Forward Work Programme. Again, this has been with consultation with the Chair. Nomination agreements for private sector temporary accommodation has been added to scrutiny for the 23rd of January. A safeguarding arrangements update has been added to scrutiny Forward Work Programme for the 23rd of January. And the West Glamorgan Safeguarding Annual Report will be coming to scrutiny on the 13th of March. There are two reports that have been removed from both the Scrutiny and Cabinet Forward Work Programmes. The permission to tender the carer service has been removed completely, and the Risk Management and Complex Community Casework report has been removed until a later date. So those are the changes to both Forward Work Programmes, and this is members' opportunity if they want to select any items or discuss any of these items further. So I'll just hand you back to the Chair. Thank you.
Thank you, Pam. Agenda item 8, we have no urgent items. Agenda item 9 is now that we will need to now consider going into private items included on the agenda. As you can see on the agenda, the private paragraph is there for everyone to read. I will propose, can I have a seconder, please? Alan Lockyer. Will you wave?
Yes.
Can I please ask for any public? Yeah, I don't know whether. Public or press in attendance now exit the meeting, and can this recording now be stopped?